skill. The necessary equipment for this skill is a BVM with oxygen source, simple airway adjunct, water-soluble lubricant, suction with appropriate catheter, endotracheal tube, and a capnography device. Additionally, medications such as viscous lidocaine may be used if available. The recommended PPE for this skill are gloves and eye protection. Once I've assembled all the necessary equipment, I'll locate the nostril that is the largest and the least deviated or obstructed. Measure and insert a simple adjunct. Apply a pulse oximeter to the patient's index finger. Have my partner assist ventilations at a rate of 10 to 12 breaths per minute, allowing for adequate chest rise. Auscultate lung sounds bilaterally. Once the patient is pre-oxygenated and I've lubricated the distal tip of the ET tube, I will have my partner discontinue ventilations. I'll remove the airway adjunct, position the patient's head, and insert the ET tube through the nostril. Once the tube is positioned above the patient's vocal cords, I can listen for lung sounds in the end of the tube or notice misting in the tube. I will then instruct the patient to take a deep breath in while I guide the tube through the vocal cords. I will also use cricoid pressure. Insert the tube to the proper depth and immediately inflate the cuff with a syringe. Assist ventilations. Have my partner continue ventilations while I confirm tube placement by auscultating over the lungs and epigastrium. I will also confirm tube placement through a secondary device such as end-tidal capnography. I'll then secure the device. Then continue to ventilate the patient at an adequate depth and rate while observing capnography and pulse oximetry.